Hey, my name is Travis Swales, and we're going to go over some of the effects of Vapocoolant Spray before we learn how to apply it. Some of the effects: you're going to decrease the pain, you're going to decrease the sensitivity of subcutaneous nerve receptors, and all that is a fancy way of saying we're going to numb the area. You're also going to break the pain pain cycle. So we're going to go into some of the indications when you would use it. It would be a decreased range of motion. You're going to have trigger points and muscle spasms. There are some cases where you would never use it. Some of those would be you had vasospastic disorder, which is just basically insufficient blood supply to that area, so like Raynaud's disease or something like that. Cold hypersensitivity, they're not going to be able to feel how cold it's going to get, so they're not going to be able to tell you when to stop. You're not going to want to do it around the eyes. You don't want to get this in their eyes. That's basically the point behind that. And you don't want to do it with acute or post-surgical injuries. Then also you don't want to do it with open wounds. It's the same concept as around the eyes. You really don't want to get this stuff into it. Some of your precautions, some things that you want to be cautious of when you're doing this, is that some of the ingredients in here, they are flammable. It's the ethyl chloride, and you really don't want to set something on fire when you're trying to help somebody. It's also a natural anesthetic. If inhaled, you can't really help your patient if he's asleep, he or she is asleep. And then improper technique, that's going to cause frostbite to your patient, and that's just bad news waiting to happen. I'm here with a patient that got kicked in the shin, and one of the most efficient ways to give her some relief is this handy dandy Vapocoolant spray. Okay, so there is a proper way to apply it, just like everything else. You're going to hold the spray. It's 12 inches away from the skin at a 30-degree angle, and you're going to spray 5 times distal to proximal. But before you do all that, you want to inspect the area that you're going to treat. You just want to check for some open wounds, which she clearly doesn't have any. Also, sometimes there are different ways to apply it. You just want to read the back of the can. So this one, it says hold cans 4 to 6 inches away from treatment area. There's a big difference in the 12 inches. Spray until the area of skin turns just white. We're not going to do that one. We're just going to spray it 5 times. So, like I said, she got kicked in the shin. We're going to administer this, please. Can you turn your head so we don't get this in your eyes? Thank you very much. Distal to proximal, about 12 inches away at a 30-degree angle. 1, 2, 3, 4, 5. She should feel some relief here pretty soon. If not, we'll administer a little bit more.